Signal now, thank you.
Go.
Health experts plead for people to get vaccinated, but for those who are already vaccinated, there are new questions now about the need for another dose. Pfizer is scheduled to present its COVID vaccine booster data to CDC vaccine advisors today. Touro Internal Medicine physician Dr. Schuyler Williams is here to talk a little bit about the theory of boosters. Good morning, Doc. So at the moment, the FDA panel said, you know, they were going to go for boosters, but not for everybody. The advice is, at the moment, 65 and older?
Yes, good morning. That is correct. An advisory panel to the FDA made recommendations as of Friday that vaccine boosters should be made available to those who are high risk. And that would include patients who are age 65 and older, or at high risk of contracting COVID-19 and having severe illness from it. So those were the recommendations that the FDA received from that panel on Friday. We're still awaiting further guidance from them and on that decision at this time.
Right, and there's kind of a give and take between the experts right now about whether this booster, this third shot, would be necessary or would be necessary yet. Maybe that's the question.
Yes. There's support for boosters. The reason why we're considering them is because we know that the vaccines remain to be the most effective way to reduce transmission of the virus, as well as reduce the risk of severe illness from it. For that reason, a booster of the vaccine is being considered, like I said, for high-risk patients at this time. The idea behind boosters is that, one, it can help prolong immunity. Like other vaccines, we can see reduction in your protection from the vaccine over time. So a booster would allow us to prolong your immunity even after receiving your initial dose. The second reason would be to help us to be able to tailor the vaccine for the future in case any future potential variants might form.
Sure. For somebody who's gotten the one-shot Johnson & Johnson, Johnson & Johnson did make some news yesterday when they talked about a booster themselves, but beyond that, I mean, can somebody who got the J&J just go get a booster of Moderna or a booster of Pfizer, or how does it work?
That's such a great question. The answer to that question is no. Right now, we don't have enough data to support anyone who's received the Johnson & Johnson vaccine in the past to receive an additional dose of an mRNA vaccine. It's very likely that in the future, anyone who received the Johnson & Johnson vaccine might need a booster of that vaccine in the future, but we're just still collecting more data on that at this time.
All right, we'll see how it sorts all out, and I know that eventually this guidance is going to change as time goes on, but we're not maybe there yet. We appreciate it, Dr. Schuyler Williams from Touro. Thanks.
Thank you so much for having me.